Hi.
Hi,
How are you?
I'm good. I can't see you. Hang
Can
on.
you hear me okay?
I can hear you okay. Can you hear me or should I use my headset?
I can hear you.
For some reason it won't let me go live.
You're live.
It's so weird. I can't. Okay. I don't know why
Can
that's
someone give
happening.
us a thumbs up if you can hear both of us and see both of us? Everyone? Okay, I'm assuming that everyone can see us. I can see you. I can hear you fine.
Okay.
Okay, cool.
Hang on.
Okay,
Let me just
so
this button
uh,
and just see if it changes anything, okay?
mhm. We just lost you. I'm going to send you a request again. We just lost you. All right, I'm sending it again.
Okay, can you see and hear me now?
Yeah, everyone can see and hear you.
Okay. That's fine.
So
I can see about half your face.
you can see half my face?
It's not your fault. It's something
Okay.
the screen.
Okay. All right. So everyone can see our whole faces. Thumbs up if you can see our whole faces. Okay, so we're gonna get started. Sorry, I was running a little bit late. I spilled my water bottle all over my floor, so I had to clean that up because this is what happens when I rush. So I'm really excited. We have Dr. Aviva Gaskill with us tonight. She's awesome. She's also a Philly area psychologist, which I love connecting with because it's this very small, tight-knit community out here. So I'm going to give a little introduction on you, and then I'm going to hand it over to you to kind of tell everybody what you do, where you practice, and all of that. And then we'll start. We're going to be talking about something that I work with a lot of people on. I know this is one of your specialties as well, and something I think in the craziness and chaos of the pandemic has kind of gotten pushed to the side a little bit. I'm thrilled that people are talking about depression and anxiety and mental health issues with being quarantined and having this kind of global trauma, collective trauma. But one of the things that I don't think people are talking enough about is the interplay between our mental health, depression, and anxiety, and the impact it has on our physical self, our bodies, chronic illness, particularly the illnesses that we kind of think of as invisible, right? So a lot of autoimmune diseases, a lot of neurological diseases, things that are triggered by stress, but also things that trigger stress. And it becomes kind of this vicious cycle, which is why when you treat mental health and you treat standard medical health, that the two are not separate. In fact, they're very much intertwined, and it would be naive at this point with what we know and the research we know to not look at them as kind of one and the same. So that's what we're going to be talking about tonight. I have a bunch of questions that I'm going to ask Dr. Gaskill, and then at the end, we will leave some time for questions from you guys if we have time. Okay, so Dr. Gaskill is a clinical psychologist outside of Philadelphia who specializes in health conditions and sexual issues. She is also the founder of Bet Me a Date, a dating accelerator helping connect people and communities to develop better dating lives, gain self-confidence, and meet their dating goals. And I have all her information on my Instagram page, but definitely check out her Instagram page for Bet Me a Date. She posts really kind of my type of humor, these kind of really witty, sarcastic kind of, but yet helpful posts on dating and relationships. So I'm going to hand it over to you.
Which has been hit hard these days.
What'd you say?
Which I said has been hit hard these days.
Yes,
dating.
yeah, I agree, and much needed.
Yeah.
So why don't you tell us about yourself and a little bit more detail about your practice?
As Dr. Zuckerman mentioned, I'm a health psychologist. I specialize in working with folks with a variety of chronic conditions and also some acute and terminal issues as well. I see folks with everything from cancer and HIV and autoimmune diseases, lung issues, anything like that. I also end up seeing some folks that are run-of-the-mill depression, anxiety, that kind of thing. I recently founded a company, Bet Me a Date, and can be found at betmeadate.com, to help connect people. I find people are just really lonely right now and isolated. And I actually started it before COVID, but I just want to help people better find love, and it's not a dating service. It's a website to actually help people meet their dating goals. So, you know, I'm hoping to help people who maybe are more introverted, have dating anxiety, have a hard time putting themselves out there, people who are maybe recently sober, people who feel too busy to date or kind of find excuses, to help them and their loved ones find and meet their dating goals and accelerate their dating goals.
Awesome. So we're going to start questions. Can you make your volume a little bit louder? Is that possible?
Sure, I can try.
You
know what? I'm going to plug in my headset.
Okay. So I'm going to start with first question that I have for you. If you can, I'll kind of chime in as necessary, but can you discuss what an invisible disability is, or an invisible illness is, what it means, and then give some kind of common examples that people may not necessarily know are considered invisible disabilities?
Yes. Okay. So just textbook definition. First of all, I want to put out there, a lot of people live with invisible disabilities or invisible illnesses, and they don't even know or consider them to be invisible illnesses. I think that's really important. I have a child who has a chronic condition, and it wasn't even until I said to a family member, my kid has, a chronic illness. They were like, oh. So that's, I think, one thing that's really important is just to name it. But invisible disabilities or invisible illnesses are a physical, mental, or neurological condition that's not visible from the outside, but they can limit a person's movement, senses, or activities. So these can, run the gambit from a lot of what I see a lot of is people who have co-occurring medical and psychological conditions, typically. A lot of chronic pain, a lot of chronic fatigue, right? Those are sort of the two hallmark symptoms of folks that I typically see, and I think for you as well. Things like people who have chronic migraines and head injuries, people with neurological conditions, autoimmune conditions like multiple sclerosis, MS, HIV, not an autoimmune condition, but very important, Ehlers-Danlos Syndrome. And I just want to give a shout out to my Ehlers-Danlos people, because it is officially the day of the zebra, I found out earlier, actually a couple of hours ago. So that's their symbol. So it's International Day of the Zebra. Folks with stroke, tinnitus, other kinds of audiological conditions, people on dialysis and kidney conditions, lung conditions, people living with post-COVID syndrome. That's a really important one. Those people we're going to be seeing more and more.
That's going to be such a mental health crisis.
Yeah.
A proportion. And I don't really think people understand the psychological effects that's going to happen with that.
Yeah. Exactly. University of Pennsylvania actually already started a post-COVID center, at least here in Philly. Okay. Sexual health issues like PCOS, endometriosis, gastrointestinal issues like Crohn's, colitis, people with sickle cell disease, and also serious mental health conditions are also really considered, invisible illnesses. Mm-hmm. I would say things like chronic pain and chronic fatigue. Chronic pain in and of itself causes a lot of brain fog. And that's one thing. And also for folks with MS and EDS, so multiple sclerosis and Ehlers-Danlos, those people actually, not only because of pain, although that it can be a result of pain also, but they actually, you probably know this, but they don't get into the deep waves of sleep. They don't get into the late stages of sleep. And so those people are exhausted, and then they have chronic pain on top of it. It's just really hard for them to get by every day.
And people will simply say things like, well, you need to get more sleep.
Right. It's not that simple.
It's infuriating and it's frustrating because it's not for lack of trying.
Yeah, they can sleep 14 hours a day and not be well rested because
Right.
their brains literally will not allow them to get into those deep stages of sleep. One of my, and I will say, if we have any family members listening, you know, we'd love to hear from you. If you have a family member or a loved one with chronic invisible illness. But one thing that's important for you to know if you have a loved one who lives with chronic fatigue is that I remember my mentor in grad school said, it's like you have the flu, like you're that tired all the time. And to me, that was like, oh, okay, like that I could wrap my head around. Yeah. This is not regular tired. We're not talking about regular old.
Yeah. I guess it was back in October, before COVID came out, but I'm still on the fence with this. But I got extremely sick, not this past October, but the one before. Yeah. Ended up in the hospital, which would never happen in the emergency room. The body aches were unbearable, and they thought I had the flu, didn't have the flu. And I remember it knocked me out for a good 2 to 3 weeks. Wow. And I remember the fatigue. Yeah. And I've been tired, obviously exhausted before, but this, I've never experienced anything like this. I just remember thinking, this is what they feel. This fatigue, it was so debilitating. I couldn't even move my hands to pick up the remote. It was like, I couldn't even do that. And so I remember thinking, God, this is what it feels like. And to feel like this all day, every day, and have people not believe you, or have people not listen to you, or people think you just need to sleep or you need to eat better, it would be infuriating. At least I knew I had a virus and that's why I was sick. But and people, you know, understood that. But for people that have had this for years, I mean, it was, I just remember having that thought of like, God, they can't function. Now I know, you know, I mean, not that I know how they feel, but that level was so severe that, you know, and then this is where obviously, and we'll get into this, but this is where clearly depression, anxiety, you can see how there's no way around that. I mean, if you can't engage in activities that you used to that were meaningful and that were purposeful, you lose your sense of self, you lose your identity. If you were like, you know, an avid athlete, and now all of a sudden you can't even get up to go get the mail. I mean, and we're seeing this with long haulers with COVID symptoms, you know, and just in general, people with autoimmune diseases, people with chronic illnesses in general.
And I'll say you know, again, I know you see this too, but like, I know for all of us health psychologists, right, we see patients and sometimes they don't have a proper diagnosis, or like with MS, right? A lot of times you don't get a diagnosis for years sometimes.
Years.
Yeah. Or even I've had patients decade or more not have proper diagnosis for their conditions.
I'm sure.
Yeah.
So I want to move on to the next question. Yeah. So one of the things I think is important for people to really kind of grasp, either if they themselves have an invisible chronic illness, or their loved ones, or if their employees have them and they're taking time off. But 3 main ways that invisible disabilities differ from visible ones. One of the ones that I see often, because I work with this population specifically, patients with epilepsy and other seizure disorders. And so seizures aside, they go throughout their day with chronic worry, chronic anxiety, chronic depression, worrying, am I going to have a seizure? Or I've been seizure free for 10 years. I'm on the perfect cocktail of medications. And then all of a sudden they start having side effects. They have to switch their meds and they're fearful. One of the biggest fears, I could see someone that's been seizure free for 30 years. If you ask them what their biggest fear is, it's, when am I going to have another seizure? Yeah. So even if with these invisible illnesses, they've been asymptomatic for a decent amount of time, there's always still that anxiety about if and when. And there's still a degree of control that you have to implement into your day-to-day to prevent these things from happening. You have to take your meds. This isn't like worst case an antibiotic where you skip a day, you know, or birth control where you skip a day and you double up on the next one. But it's more of a, you know, if I miss this dose of medication, I'm going to have a seizure. And then you have to go through the whole process over again. So if you can kind of talk about 3 main ways that invisible disabilities are different than visible ones.
Yeah. So if it's okay, I'd like to name 3 and then go back and sort of talk a little bit more in depth. So one, and this is the main one that we see, and like really the main one, they talk about this in some of the groups too, but like you look okay, right? You look okay and people think you are okay because you look okay, but you're not okay, right? So that's number 1. We'll go back. I think not, you know, you can, if you're having a run-of-the-mill issue, right, like you can go to regular doctors, but when you have a very specific illness, you really often need special, you know, highly specialized physicians, right, and care providers, medical providers who know how to care for your conditions, which can be really hard to find. And the third one, which you mentioned, and I want to go back and talk some more about, which is that you don't know how you're going to be from day to day, right? Yeah. You don't know what today is going to look like and tomorrow's going to look like. In fact, we don't know what we're going to look like in an hour from now.
Right. I was just going to say, we don't know what we'll look like in the next minute.
Yeah.
We can make a plan to go to dinner and we're ready to walk out the door and a migraine hits.
Exactly. So in terms of this, like, looking okay, and this is the main one that really is a huge difference, particularly for people with invisible illnesses, is that, you know, when someone is in a wheelchair, someone lives with Down syndrome, those have some obvious telltale, you know, physical signs, symptoms. It's very clear in a lot of ways. Those are very, very challenging to live with as well. And so I do not want to downplay those. Yeah. But in particular, it is different with people with invisible illnesses because they look okay, right? But they're constantly battling their own bodies. They're constantly fighting to get up, to get out. And because they look okay, people often will treat them like they're okay, and they are told like, oh, you should just push through, or, you know, like, and they feel like they have to more, right?
Yes. And that's true also for, you know, it's just a mental illness too. I mean, how many times have you been telling somebody how anxious or depressed you are, and they're like, but you look good.
Yeah. You don't look like you're having a panic attack.
You don't look like, right. You look fine, right?
Yeah.
You look good. And, you know, and I think that people deal with that all the time. You know, something like diabetes or epilepsy, or even something like glaucoma, which is an, you know, kind of this, you don't know they have it, but the struggle that they have on a day-to-day basis of being able to just even just look at them. I mean, there's so many, you know, your eyes are like your biggest sensory, you know, so truly, really any type of illness that you can't see, that other people can't see, even people that know you have it, they may misperceive you having a good day as you feeling well. What they don't understand is that the amount of effort and energy and time and resources that you have put into being able to get out of the house, let's say for Thanksgiving dinner, or to go to dinner or go to a movie, that effort that you put into it was so above and beyond what other people may do. And so when they say, well, you look good, it's not with bad intentions, obviously, but it's really invalidating. And not only that, but if you think about how much effort somebody has to put in to get out of their house, then when they're actually out of their house and at dinner, they're exhausted. Yeah. And then what happens is they're exhausted during this event that they've looked forward to, and they either have to leave early or they're quiet. And then people will say like, are you okay? You seem sad. And you're thinking, my God, I just put so much energy and effort to this, and it's still not enough for me to feel like I'm part of this. And it's just this vicious cycle. And there's a lot of nuances, which is why you really have to make sure, like you said, you have to find a specialist in your area. You have to hope to God that your other care providers, your primary care doctor, your cardiologist, your PT, on treatment kind of integration, because you have to have everybody on board. You have to find a psychologist or a therapist that specializes in the nuances of these, because otherwise you're going to be working on sleep hygiene that's going to do absolutely nothing for you.
Exactly. Exactly. And that is such the common problem. And I want to go back and highlight something that you said. You know, this thing of like being at just a dinner with friends or whatever, right? Like it's enough to just get yourself dressed and out the door. And for them, sometimes participating is just sitting there. Like that's all they can do. So they're like, I'm here. Like, let me just kind of sit here and take all of this in and sort of, you know, can you check in with, if you are a loved one of someone with an invisible, you know, illness, or if you're the person living with it, you know, and you want to encourage your friends and family, can you say to them, like, just check in with me and ask if I'm okay and if I need anything, but don't like, you know, be upset with me or, you know, act frustrated if I'm not participating. Like I'm doing as much as I can, you know?
And I think that's really hard for people who, and that's what I work with them on, is this idea of asking for help. But that's so difficult for people that have lived with chronic illness for so long, because truth be told, people around them, they get annoyed and they get frustrated and they get overwhelmed and they get frustrated. I mean, because they want to help this person, but it's not necessarily going anywhere. And so it ends up being, again, it's all about this vicious cycle. They want to ask for help, but they do. The other person's exhausted too from caring for them, and then they feel like a burden, and it's kind of this back and forth. And so I always recommend, I'm sure you do this too, to when you ask for help, to kind of identify the type of help you need, and make sure that you identify the people in your support network who can give you those particular types of help. So, you know, just unrelated example, if you need help with your finances, you're not going to go to your dentist, right? You're going to go to your financial advisor or your accountant. If you need help with losing weight, you're going to go to a nutritionist. You're not going to go to your accountant, right? So it's you have to make sure you identify the type of help you need and then seek it out accordingly. I think that spreading it out really helps all parties involved with that.
Definitely. And I also want to just highlight, because this is really important too, I think that in terms of like medical providers that we were talking about, it is hard enough, and I'm sure you know this, right? Like to find certain providers who specialize in certain areas. I also want to highlight, and I think this is really important just to sort of wrap our heads around, if you have a particularly rare condition, if you are a woman, a person of color, you're low income, you're in the LGBTQI community, you're an immigrant or have an accent or don't speak English, as well, you don't have as much in your English vocabulary, that can be much, 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 much harder of an experience, right?
Yes.
And so, there's another issue too with medical issues, which is that people often don't feel like they're going to have the care that they need in a medical emergency. If they have a special issue, right? Like, with epilepsy, like people have bracelets, with, severe allergies, but that's not true of a lot of conditions, right? Or people don't, are not familiar enough with that kind of condition that they sort of know what to do. And so like, our folks with like dysautonomia, our folks with, sickle cell disease, right? Like those are very, very frightening situations for them to have to go to deal with a medical emergency in.
Yep, absolutely. And it puts a lot of fear and anxiety, and sometimes it becomes emotionally easier to just say kind of screw it and not do the things you want to do, which then contributes to the isolation and the belief that you're not capable of doing certain things. And it starts to really isolate you.
I actually have patients who will not go to the ER, even though they actually need to. And their other doctors are telling them to, because it's such a horrible experience.
It's such a horrible experience. I agree. And then like you said, throw in, not speaking English as your first language, or not having insurance. I mean, that's a big thing too. Or, having lack of trust in the medical community. I mean, so there's a lot of variables with that. So let me move on to the next one. And we've kind of touched on this already, but how all of this impacts a person's mental well-being and why. And then also kind of roll that into the stigma that's attached to things like that. I know I can speak. I had a patient this happened with the other day. They have epilepsy. They have a very specific type of epilepsy where when they have seizures, they kind of just look like they're kind of spacing out a little bit. They kind of look like they're just staring, and it's only for a couple seconds, but they're just staring. So a lot of
it's not a grand mal seizure.
No, and in fact, most seizures aren't. That's the thing. You know, we think that when we hear epilepsy, it's people kind of falling on the floor, convulsing, shaking, foaming. I mean, we think of this horrible thing. Now, do those types of seizures exist? Yes, they do. Yeah. However, there are so many other types of seizures, so many other types of seizure disorders that aren't even epilepsy. Yeah. And there's such a stigma attached to it. So you have people whose seizures maybe aren't even noticeable. Sometimes it's this internal, almost like they describe it as like an uprising in their stomach. They feel this kind of warm, bubbly sensation, and they don't, that's it. That's all they'll have. And so this idea of epilepsy or seizures, they don't even want to tell their employers, they don't want to tell their friends, because then people get nervous to be out with them because, oh my God, what if they have a seizure at the restaurant? What if they have a seizure when we're out at the mall? Like, what if they have a seizure while they're driving, even though that's not the type of seizure they have? And so part of this too is having to educate the people around you to reduce the stigma. But again, that's something that's put on the responsibility and the shoulders of the person with the illness who's already exhausted and frustrated and used to people not listening to them. So for them to just voluntarily educate other people can be really difficult and just even more exhausting. So they end up not saying anything.
Definitely.
So that's something that I've seen happen a lot. You know, especially with college age students. Yeah.
Oh yeah. It's so hard if you are in your 20s and you feel like you have the body of an 80-year-old, right? And we hear that all the time.
Yeah, and I know if you're dating and you have these conditions, when do you tell your partner? How do you tell them? I mean, is it something you're going to tell them and then feel like they're going to think you're a burden? There's so many things with this. It affects every aspect of your life.
Yeah. So, you mentioned anxiety and depression, which obviously, like, especially with something like seizures or something that can have these, I mean, it's true with anything, right? But it's not necessarily just the sudden onset kind of, symptoms, but those, depression and anxiety are huge within this population. Certainly within certain populations, right? I know you work with a lot of folks with MS, right? So depression is in and of itself a symptom of MS, right?
From neurological, organic reasons, not even because they're depressed about not being able to do things. It literally causes depression.
Exactly. Things like for Ehlers-Danlos, a lot of the symptoms like the tachycardia and kind of, increased heart rate also mimics anxiety. And so it can get very confusing about like our brains. Our brains are really good at noticing the symptoms. What they're not good at is understanding, is this a tachycardia? Like, am I just having, is my heart just racing because it's racing? Or am I having a panic attack? Am I feeling really anxious right now? Another thing, and I'm sure you see this a ton, is that people develop very serious self-confidence issues. That in and of itself is not a mental health condition, but it's definitely something that we see a lot, and it's part of overall mental health. Because they think that other people are telling them that's all in their heads. They feel like other people are, sometimes people do tell them it's all in their heads, right? I would say another thing is making sure you don't get addicted to substances is really important, because a lot of times, and this is nothing against physicians, but sometimes physicians will not know what to do with patients who have certain chronic conditions. And they will say, just go see the pain management doctor. And the pain management doctor, this is happening less now, but like 10 years ago in particular, they would just get thrown on opiates. And you cannot be on opiates if you have a chronic pain condition. It will only cause addiction. It's not suitable if you have, there are other options for pain, but opiates are not them. Like prescribed opiates are not okay. Medical PTSD is a huge problem. I'm sure you see this a ton.
Can you talk to people about, I don't think people understand what medical PTSD is. Can you explain what that is?
Yeah, so for folks who have developed any kind of trauma around repeated unnecessary surgeries, sometimes repeated necessary surgeries, things like, being brought to the ER. It's very common. There was a study a few years ago that came out about people who've had tracheotomies and tracheostomies. So these kinds of things, again, right?
Like childbirth, even, sometimes people won't have another child because the experience was so unbearable, scary. It could have been a near-death experience for them, the child. So, any type of like you said, unnecessary, but also necessary. Also, medication side effects sometimes can cause that hair loss.
Yes. And even just the repeated exposure to going to the doctor or, any kind of healthcare professional who's telling you or giving you the sense that either it's all in your head or sending you from doctor to doctor to doctor and passing you along.
Yes. Yes.
Yes.
And also, things like cancer, with chemo things, there's people that will throw up just even pulling up to the hospital as kind of this reaction to knowing the treatment that they're going to get and the symptoms that happen. They actually have a physical reaction to it pulling up to the hospital. I've heard that a bunch.
Yes.
And the being passed around from doctor to doctor. This was, oh gosh, I don't even know. I'm not even going to say because it's going to make me sound really old, but I had I guess what you call like a disc, or I don't know what it was, but something was very out of place. And I was getting horrible migraines and horrible. And I just remember trying to navigate, and this was like in grad school, so I knew the medical system, I knew the hospitals, I knew doctors, I was in that community. When I tell you how difficult it was for me to get a diagnosis of what was wrong with me, right? Yeah. And went from doctor to doctor. And I just remember finally being at some doctor at Penn, and I go into her office and she's like, oh no, I don't do that. And I just remember feeling of just total helplessness, like, oh my God, they sent me to you. I've waited 2 months to get in here. Like, so, and that's for something like a herniated disc and, headaches. To have something that is so debilitating, so much more debilitating than that, and not having the energy to go from doctor to doctor when you're not in that community and you don't know it as it is. It's just,
and sometimes, and I'm sure you've seen it, the patient gets labeled as a doctor hopper, but it's not their fault. They're getting pushed along in the system.
Yes.
I think another thing that happens so much, right, and we talked about this a little bit, but like you get perceived by friends, family, coworkers as a complainer, right? If someone who has a chronic pain condition is complaining about it, they are in a ton of pain, right? They don't just complain. These people are not complainers. They live in pain every day. It must be excruciating if they are complaining about it.
And I think people don't understand that. When you have a chronic condition, when you get to the point where you're complaining, it's a last resort.
Yes, most definitely. I will also say workplace problems are huge, right? You mentioned that. Sometimes people need to go on disability. Sometimes people wait too long to go on disability and they get fired for cause before they can. This is obviously like a really sticky thing to navigate, but I think it's important to consider if you are a working person, to consider and talk to your loved ones and maybe even a therapist. How and when will I know that it's time for me to go on disability? Should I need to? What will that look like? All of that. Let's see. And again, I want to go back to people getting labeled as chronic complainers. This is especially true for women and for people of color. It's constant for those folks. And I think, that's true of anyone who lives with a chronic, invisible illness, but it is especially true for those populations.
Yes, no, I agree completely. And I think it's also way underreported because I think those people aren't seeking the necessary treatment, and then they end up getting treated for the conditions that arise out of that condition, and not getting treated for the condition itself because they waited too long, and other symptoms stemming from that condition are deemed more appropriate. So, like I said, talking about like lupus and some stuff in that kind, they may get treated for something totally unrelated to lupus, but yet is almost like a side effect or a symptom, and then they'll get that treated and they'll get another aspect of it treated, and then they're on all these medications, which are all treating the symptoms of this underlying illness, but the underlying illness is being completely ignored, either by diagnosis, either by just not going to the right specialist, you know,
And I think there's subjective and objective symptoms, right? When you go to the doctor, right? Again, there are certain things that they can see, that they can measure, that they can look at, right? They can do an MRI, right? But there are certain things like fatigue, like pain, that are completely subjective symptoms. We do not have a good measure of them.
right.
I remember one time my husband and I, he's fine, but this was years ago. We had to go to the ER and he was having an issue, and like I said, he's fine, thank goodness. But the person who did the intake with him said, 0 to 10, what's your pain? And he was like, I don't know, it's like a 6. And I was like, we're not in the ER because you're having a 6, right?
Exactly.
But it's a tricky thing to navigate. And particularly if you live in chronic pain every single day, and maybe even every moment of every day, that's a really sometimes hard question to answer. What the pain feels like, right? Is it burning, itching?
I mean, at a certain point, you get used to the pain. Your pain baseline is very different than someone who doesn't have chronic pain.
Yeah.
If you get migraines, this happens to me. I'll get a migraine, and I'll say, like, did you take Advil? And I'm like, Advil, we passed that years ago. But it's interesting because I could have a migraine, and because I'm unfortunately sometimes used to, let's say, how that feels. Somebody who just gets a headache, but gets a headache, to them their pain may be exceptionally high. But same thing for if I have a backache and I never get backaches, I could be in agony. But somebody else who lives with it every day, it's that subjective pain can kind of impact how you want to report it as well. And you may not be reporting it accurate enough to get the treatment that you need. Because if your husband's reporting a 6, they're going to treat a 6 very differently than if I come in there and I say it's like 100 out of 10.
Yes.
Right?
Yes.
I also think, too, though, speaking of men, I think that there is a significant difference in the way chronic pain is treated in men versus women.
Most definitely.
If a female comes in and says that she has chronic pain in 8 out of 10, and a man comes in and says he has chronic pain 8 out of 10, not all the time, but a lot of the time, the man is going to be viewed as, oh, man, he must really be in pain if he's saying 8 out of 10. That's something that just has to be, that stigma has to be broken. And I think that goes to what you said, that women are viewed more as, complaining or overreacting, or it's all in our heads, when really, one, we're just more vocal with that, right? And 2, a lot of times we're more in tune to that. We also are not as unwilling to seek help, right? Men a lot of times will just kind of suck it up, or they'll drink, or they'll self-medicate more so than females will. Not that women don't, but men are way more likely to do that than females. So,
and 3, this is not just, Dr. Jamie Zuckerman and Dr. Aviva Gaskill saying that. There is a lot of research on this too, right?
Yeah.
So, and I think that's important to highlight. I think that the only other couple of quick things I want to say, because I know we need to move on, is that so there's something called spoon theory. I'm sure you've heard of it, but I just want to sort of highlight that by Christine Miserandino. If you are watching and you want to check out spoon theory, it's something that I think a lot of folks in the invisible illness community really glom onto, and I think it really helps people who are lay people who don't live with invisible illnesses to understand how spent you can get and how quickly that can happen. In fact, I had a friend, not knowing I was giving this talk today, but refer to this the other day, who's having some medical issues. There's also something that I loved on Facebook that I saw that was posted by someone named Taylor Davis. And it was just this guy kind of holding up some signs, but he talks about living with chronic pain every day and what that's like for him. And I just thought they did a really good job of sort of explaining that in kind of a meme form, in a way that I thought was really nice.
So last question we have, and then we'll leave a little bit of time for questions from people here. And again, if we don't get to your questions, feel free to DM myself or Dr. Gaskill, and we will try our best to respond to them. So generally speaking, what treatments and supports are available for people out there, people watching this, people who have, family, friends, loved ones who are experiencing situations like this? What can they do? Where are treatments available?
So there's a lot of different options. I'm going to put a few different support communities and sort of opportunities out there, but the Invisible Disabilities Association is an amazing resource. They really support people who live with invisible disabilities and invisible illnesses, whether you have a named condition or not, right? And that's also really important. Some people, again, don't get a diagnosis or a proper diagnosis for whatever they're living with for years. And so it's important to know, like, there are people who understand, who get it, who care about you, who don't think you're lying and faking and making things up. And so the Invisible Disabilities Association is great for that. I would say, and you and I are biased in this way, but therapy, there are therapists who, like you and I, specialize in pain management and acceptance of, what you're going through for families, couples, right, sleep issues, all kinds of things. There's also a lot of local support groups through hospitals and nonprofits that exist for a variety of different conditions. If, again, you have a diagnosed condition, and not everyone does, but a lot of times there are national and even local branches of organizations like the National MS Society, the National Multiple Sclerosis Society, the Ehlers-Danlos Society, things like that, the Crohn's and Colitis Foundation. So there are all these different places that people can go to get support. They often will also have support groups and online communities. And there are Facebook groups and other things. There's also sometimes courses out there. And I will say I have a colleague who is currently trying to create a directory for mental health providers who specialize in medical issues and which medical issues they specialize in.
Right.
So
in this area or just throughout the United States?
All over the world. So she's amazing, and she is trying to create a program. It's called Find Empathy. Empathy with an IE, not with a Y, .com. And she is working to help patients find providers who understand their conditions. And so I would say, even if you do have a named condition, right? Like, I know the National MS Society, they provide, they have lists of providers in different areas who can work with you. Mm-hmm. The EDS Foundation, there are a couple of therapists and mental health providers on there who work with them. And so go to those online organizations and see, who you might be able to work with. That's a really, really wonderful way. But there are therapists who specialize in different issues. And I think that's really important for everyone to know.
So I think if we have 5 minutes, I'm just going to scroll up and see again. I'm not going to get to all of them, but I'm going to scroll up and see what questions we got that we didn't answer. Let's see. Best. Okay, let's see. Somebody wrote, invisible wounds are equal to visible wounds. I love that. I think that's excellent.
Yeah, 100%.
So what is... Well, actually, somebody wrote, the energy we summon for the event that we're going to, this is when we were talking about going out, can then cause a flare.
Yes.
After the fact, because of all the stress and energy and, kind of pressure you've put on yourself and your body. And that's exactly right. So that's why a lot of people avoid going out, because they put all this energy into going out, and then they get there and they're so tired, in so much pain. They have to figure out a way to leave without looking weird, and you're feeling weird and thinking they look weird and thinking they're a burden because whoever they went with has to take them home.
Or I would say even sometimes they're okay and they can sort of make it through that, night out or whatever.
And then they're done for days.
For days.
Yeah.
Days.
Yep.
Yeah.
Yep. And think about it. I mean, that means that if you have, let's say you have an event you need to go to on a Saturday night, and you know that on Tuesday night you have a birthday dinner for somebody. People that don't have a chronic illness, that wouldn't even come to their mind to think about something they have on Tuesday night and how going out Saturday night may affect Tuesday night. Maybe Sunday morning if you have to wake up early and you drank a lot or you were out late or something. But to think about it in that respect is really just anxiety provoking and can cause depression, because you're thinking that far ahead about something, and it's just a constant kind of mental torture almost.
Yeah, it is. It's almost, and I don't mean in a fun way, but it's almost a game that they have to play where they have to, they do have to pick and choose their battles in a way that, we all have to do that, but not in the same way on a daily basis that folks who have invisible issues have to deal with.
So let me see. We answered a lot of these. Best practices, we talked about that. So a couple people are saying they've been trying to seek treatment, and they're so frustrated and they can't find a certain provider, and they're now 40 years old and they haven't been able to find somebody. So, and I think Dr. Gaskill will agree with me on this, but if you are in that situation where you feel you're not being heard, you're not getting a diagnosis, you're still in pain, you're still going through the same stuff you've been going through for years, as tiring as it may be, honestly, the best thing that you can continue to do for yourself is continue to be an advocate for yourself. If you annoy people, who cares? If you call a receptionist 10 times over again for your lab results because it's holding you up from getting another appointment, who cares? A lot of times they'll feel that they're being a burden. They don't want to annoy people. They don't want to annoy the doctor. Annoy the doctor.
Yeah.
Annoy the nurses. If you're annoying them, then they may be in the wrong field if they get annoyed by stuff like that. So always advocate for yourself. If you don't feel comfortable doing it, get somebody else to do it on your behalf that maybe you're so used to backing down, not because you're not a strong person, but because it's so easy to get into the cycle of just giving up.
Yeah.
Get somebody else who hasn't been kind of beaten down by the system, and get them to advocate on your behalf. You'd be amazed at how much power that can have. But it's easy for me to tell people don't give up, but it's more of don't give up advocating for yourself. Almost, I tell people kind of almost make it a little bit of like a humorous game in a way. Like call and just see how annoyed can I make this person, kind of switch it around a little bit.
And use those online communities, right?
Absolutely.
I have, so even with EDS, right, because I've been seeing a lot of particularly young women and particularly women with EDS, with Ehlers-Danlos, ask me, even though I'm a therapist, I may know, who a good gynecologist who understands EDS would be, because there are particular gynecological issues, right? I might know, a particular neurologist, cardiologist, right? All of the conditions that can affect this. And it's really, really important to find a GI who knows EDS, right? Those things.
Yeah.
And so ask your other providers,
That's right.
Can they refer you to another provider who understands, a PT who understands these things? Or what recommendations can they make?
I find that, when I work with kids, this happens a lot with IBS, Crohn's. I see a lot of patients with Crohn's disease.
Yeah.
Again, all really kind of psychosocially brutal illnesses to have, because it really, they don't go on vacation. What if they need to use the bathroom? What if they have a flare-up on the airplane? What if they have a flare-up when they're outside? There's just so many. They're constantly looking for bathrooms wherever they are, and there's a lot of anxiety with that. A lot of times they'll end up in my office for anxiety. But I actually, and you probably too, I have a pretty decent list of specialists for these types of illnesses, because they're the doctors that I work with a lot, and I, kind of collaborate treatment plans with. So I know that they're very big on the interplay between all these things. And those are the doctors that you want. For people that come to me and need a neurologist, whether it's anything from epilepsy, MS, Parkinson's, ADHD, whatever it is, there are very
migraines,
few neurologists that I will refer to, because I know those neurologists personally. I know that they understand the psychosocial kind of overview of this, and I know that they're patient, I know that they're respectful, I know they won't shut people off. So I think that
and they care about their patients. They have good rapport.
I actually think, and I don't know if people realize this or not, but I actually think health psychologists probably have some of the best referral sources, you know, because these are the only doctors that we'll want to work with because they get it. So take advantage of your therapist if this is their specialty, because they'll have a ton, and if they don't, they know other health psychologists who will have referrals. You know, I would go to you for, you know, if I had somebody that needed somebody in something more special, that you're going to have the good doctors that you know to refer to.
Yes, definitely.
So the other questions we really kind of touched on already.
And by the way, I want to say that could be all over the country, right? We have sent people to Mayo Clinic. We have sent people to Hopkins, right?
Absolutely.
You know, and that's something that's important to know too. Sometimes the specialist is somewhere else.
Correct. That's right. And I, you know, and also I think with virtual medicine, that it's going to make that, I actually think if we can find one good thing that came out of all of this, is that I think virtual appointments are going to become way more acceptable now, and it's going to put a lot of people in touch with a lot more specialists that otherwise thought to go to.
I will also just highlight just something that is special for psychologists alone, not psychiatrists, not other mental health providers, just psychologists. And I don't know if you have joined, but the psychologists, at least in Pennsylvania, have recently joined a program that is called Sci Pact. It is a program all over, it's in certain states. I believe there's 15 states participating at this point. And so we are allowed to see patients, not even just during the pandemic, but even after COVID is over. We will be, able to see patients legally within those other states. Don't ask me to name all of them off the top of my head, but that's important to know. And some people are licensed in multiple states on top of that, right? So New York, for example, is not part of that, but I also maintain my New York license because I used to work in New York.
Yeah, I think this makes people don't necessarily realize too, is that first, it's separate from this, where you're talking about psychologists, even though it's virtual, I can't see anybody unless they're a Pennsylvania state resident. Even though it's easy to do to talk to somebody in Chicago, I can't unless you have a license, you know, in that state.
Or you're part of the Sci Pact.
Or you're right, exactly. Somebody asked here, are you guys pain doctors? No, we are clinical psychologists who we have expertise in treating pain management from a psychological, behavioral kind of standpoint, so to speak.
But with that said, one thing that's important that I don't think a lot of people understand is that while we don't treat pain with medicine, we do have techniques that we use, cognitive behavioral therapy, et cetera, that do help people who live with chronic pain.
You know, and it's more than just breathing, right? It's more than just breathing exercises. It's more than just mindfulness. There's a lot of different behavioral strategies, cognitive strategies that you can implement that, taken to get all of them together, can actually do way more benefit for you than a lot of the medications that are kind of thrown at people when no one knows what to do. So if anyone has any questions for Dr. Gaskill or myself, please feel free to send us a DM, and we will do our best to get back to you. This was great. Thank you so much for doing this. This was so needed. This will be saved on my IGTV. Dr. Gaskill will have a link as well that I'll share with her, so you can reference this whenever you like. And
I'm going to post on YouTube as well on our channel.
Great. Okay. And then and I'll have all of your information on my Instagram so people can reference that as well. So thank you so much. This was great, and we'll definitely do it again.
Thank you. This was wonderful.
Take care.
Take good care. Bye. You too.